This is Wes Miller, owner of Anti-Fragile Physical Therapy and biomechanics and running expert, as well as shut-in finisher. I want to thank Asheville Running Collective for inviting me to help guide you guys on the journey through your shut-in training. Mark has laid out some awesome plans and some workouts. I'm going to talk a little bit today about some technical aspects that could really help change your performance, improve your efficiency, and potentially improve your chances of finishing, let alone competing in this year's shut-in race on the first Saturday in November. I thought the easiest way to do it would be to tell a story. World, Devin. Devin, world. Devin is a member of the Asheville Running Collective, outdoor entrepreneur, and at that, a pretty incredible runner himself. After finishing the September Marathon in 2018, with just a few little niggles, he calls me late September and says, dun dun dun, the worst thing has struck, Achilles tendonitis. So we bring him into the office and take a look, and indeed, his Achilles is pretty irritated. After his 2:36 marathon in September, he thought he could really just leverage that right into his hill training for shut-in, but unfortunately, the dreaded word rest had to come up. After, of course, he tried everything else. Too little, too late stretching, kinesiology tape, changing his shoes, massage, self-massage, anything that Dr. Google could come up with. We get him in the office and really break things down, and we take a look. And what we do see is, yes, his calves are tight, pretty common after training for a marathon. And what we also see is that his hip flexors have really stiffened up. And because he's been training so much flat over this and a lot of speed work, we're seeing that his hamstrings and his glutes just aren't keeping up with the strength of his quads and calves, which is really a common thing that we see here for runners in Western North Carolina anyway, thanks to all the hills. So the first thing is, with that kind of fitness base that he's built up, I'm not too worried about him getting too tired to finish this race. But what I am worried about is the Achilles not being able to tolerate the kind of load that a course with a vertical mile of ascent, let alone a vertical kilometer of descending, can put on the body. So we've got to shut him down. We decrease his activity, give him a good bit of glute and hamstring exercises, hip flexor opening, self-massage, all the things. But we really just needed to decrease that activity, stick to intervals in a low impact environment, and give him about 10 to 14 days to see if we can get this acute pain to really shut down. Unfortunately, what that puts us to is about 10 days before shut-in, we see each other again. So we're almost to Halloween now, but he's feeling a lot better. So of course, what is his first question? Wes, can I go out and do 15 or 20 miles? Just make sure everything's feeling good? This is why I'm in business, folks. Runners learn nothing. So we say no, let's just see if we can do some intervals, see how it holds up on a hill, and what we might really need to take a look at now that we've got the strength and the mobility taken care of is what kind of technical aspects might be able to be improved to reduce some of that stress on the Achilles. As you can imagine, up and downhill running can put a lot of stress through the foot and ankle complex. The Achilles is just one part of that. So if we could maybe improve some overall technical pieces, we might be able to find that he can sustain longer and maybe decrease that per step load on his Achilles. So we head outside working on some up and downhill running technique. There's a few little technical pieces, some things that he did that wasted a little bit of energy, and some things that we talked about that could probably improve the stress on his Achilles that might let him see how far into the race that he can get before maybe things either grind to a halt or he makes it to the end. The crystal balls are fuzzy when you get a few weeks out before big events like this. However, what we found is that when I drove up to Elk Pasture Gap a couple weeks later to root on the racers in their final push, I got there just too late to see Devin come through in third place. Way faster than he was thinking. He was really just hoping he could leverage his fast marathon, finish in about that time, and maybe get some glass for the day. Surprise, surprise, he's up there moving hard, and I didn't even get to see him. But everyone says he looks great, and in fact, he reeled in almost the entire time between him and second place, finishing in third by only 5 seconds, with a time of 2 hours and 24 minutes. Way better than he had ever expected to come in on that event. And you know what he did the next year? He won the thing in 2 hours and 21 minutes. Now, after making sure this wasn't a doping thing in 2018, tests did reveal an elevated amount of IPA in his system. No EPO though. It just indicates how much a small change in your technical improvements and reducing that energy wasted can let you push yourself just a little bit farther before you have that metabolic buildup and start seeing things like cramping, fatigue, and muscle shutdown. As you know how tough that can be when you're mentally ready to push and your body just can't follow up. So, here are the technical aspects of it. Here's what Devin and I talked about in 2018, and hopefully some of these things will be useful for you too. First things, downhill running. There's two things that I really talk to people about that you can cue into and see if you can improve your overall capacity. One is set your foot down at the same angle that the hill is going downhill. So if we see here, I've got my foot back, body's leaned back, knees straight, foot flexed back. What's going to happen as soon as my body weight hits the ground, there's going to be a large, quick impact pushing my foot to the ground off the heel. Or what I can do is I can soften the knees a little bit, point my foot down, and you can see as I point my foot down, what that's going to do is it's going to automatically move my body weight forward over my feet. It's going to soften the knees and soften the hips. And if I can land in that position, what I have is I have a lot of springs ready to help me, as well as using the posterior side of the body, the hamstrings and the glute muscles, to help slow down rather than waiting for the pound to happen on the lead foot. This will also tend to shorten your step up a little bit, and that's actually desirable because that means there's less force per step as you slide down the hill. The second thing to think about is, where is my body position? Some people are just not comfortable downhill runners, and that's totally okay. However, if that leads you to really leaning your body back away from the hill, unfortunately what that does is by leaning that back, you've got to put your feet forward in front of you. And again, that's just going to accentuate that hard pounding aspect. So then people run really slowly to try to mitigate that because they just don't feel in control. It's sort of like downhill skiing. Sorry if you're not a downhill skier, but I'll explain it in those terms. If you lean too far forward on your skis, you're just going to accelerate fast down the hill, eventually lose control, and you're going to crash. If you lean too far back, you pick the tips up off the ground, and again, you don't have side-to-side control. Eventually, you're going to run into something, and you're going to crash. It'll just be at slower speeds. So if you can find that sweet position with the ankles forward, knees over the toes, hips down on top over the heels, you can find a great position to control your downhill momentum in while trying to accelerate it as much as possible without letting gravity take you too far away, as you can see in this frame right here, where you end up having to use the egg beater technique and basically turn your arms into sort of gyroscopes and stops so that you can make it around that corner, as opposed to on this frame where you can see I've got a nice easy trajectory because my hips are soft and I can take a lot of short steps to move around that corner. So there's some technical performance pieces with this too. As far as uphill running goes, really what we want to see over anything at about a 3 to 4% grade, which is just where you move out of a false flat, is that really there should be very little, if any, heel contact on the ground. The issue is that a lot of people want to sink into that hip, drop the heel, and then pounce off of that onto the other feet. So we get this really sense of sort of side-to-side movement where you're bounding back and forth. It reminds me a little bit of like Rocky, running and shadow boxing as you're going uphill. It's great if you're in a movie. It's not so great if you're trying to run as efficiently as you can up, especially sustained efforts. So what we should see is that minimal heel contact on the ground, staying up on your toes. It's going to move some of the force out of the gastroc, which is the big power muscle of the calf that's fatigable, into the soleus, which is the really slow twitch muscle that's job is to just sustain position. The other thing that that's going to do, it's going to shift your hips a little bit farther forward to lean into the hill. If you've ever fallen up the stairs, you know that you can have gravity help still assist you going up the hill. That's going to put the foot pressure more forward on your feet. It's going to get you a little bit more upright. And then what that's going to do is technically shorten your step, because every step that you take, you're going to meet the hill about 3/4 of the way into your step. So naturally, to go over a given time, you're just going to take a few more steps. But what that also does is that makes less force per step, makes it nice and clean and light, and that's going to minimize some of this arm swing that a lot of people like to go into. Now, when you get above 20% and you're really not necessarily running anymore, then our arm swing kind of has to come back. But again, that point of staying up on your toes is going to continue. And then for those sustained climbs, we really should see that arm swing back off a little bit, because your arms only have to go as much as your hips do. They're a counter rotation to keep your head stable on your neck as you run, because no one runs like this. Well, hopefully no one runs like this for very long. So what we want to see is we want to see nice, easy, relaxed arms. Now, if you're accelerating up a hill, then we can add some pump into it. But again, not at the cost of all of that extra body rotation, which again is a loss of energy. The second that you drop that heel back down, you're actually pushing your body back down the hill just in order to spring yourself and load yourself so that you can go back up the hill. We should see that arm swing ease off a little bit, especially on the sustained efforts, because your arms only have to swing as much as your hips rotate. And because you're shortening your step because you're going to meet the hill, there's just less hip rotation per step. If you accelerate, start going faster, yeah, we'll start to see those arms come in, but it can't be because you're starting to drop that heel, load the Achilles and the calf to spring back up that hill. That's a very fatigable way to do it. So for short efforts, that's fine. For something sustained like this 17.8 mile beast you're about to participate in, probably not the best strategy to utilize. So hopefully this story illustrates what the trifecta of genetic capacity, Devin's a really good and talented athlete and runner, the training and the work, being able to go in, put in the miles and do that, and then improving the skill side of running, which is one of my great passions, is to improve people's ability to run well, to run sustainably, to run toward their goals, whether it's finishing shut-in, whether it's winning shut-in, or that this is just a easy trail race that you're participating in as you then run off to do a 100-mile race a few weeks later. So please let me know if you got questions on this one. Throw them in the comments. Call Mark. Twitter. Not on Twitter. Snap me. TikTok. Whatever. I want to thank Mark Driscoll and the Asheville Running Collective for inviting us out. It's been our pleasure for almost 20 years to take care of the running community of Western North Carolina and be in the running community in Western North Carolina. So one thing we'd like to do is offer anyone who's registered for this year's shut-in race a free 30-minute consult here at our office. No strings attached. Just come through, ask questions. We'll screen out some stuff and see what we can give you. Or you can apply that to either a full first session or a follow-up, as I know many of you have already had the pleasure of coming in to see us a time or two over the years. So it'd be great to see you back in. This deal's good through the first Saturday in December to give you enough time post-race to see if your running niggles have cleared up after you turn down the volume, or if they're going to stick around and you need a little TLC, which we're happy to provide. Thanks again, and can't wait to see you out there on the first Saturday in November.